Today we're doing something a little different, a roundtable discussion with two guests who each see the innovation journey from a unique but connected angle. Martin Broch Pedersen is the Business Development Director at Health Tech Hub Copenhagen, where he helps early-stage startups navigate the complexities of regulation, reimbursement, and commercialization through programs like Health Tech Pathways. His focus is on building the right support structures that keep founders learning, adopting, and most importantly, surviving. Nicolas Bouchet, investment manager at Health Tech Hub Copenhagen, brings the investor's perspective. He's been exploring how startups can turn visibility into actual investment and how founders can bridge the gap between ideas and sustainable business models. Together, we'll talk about what it takes to move from innovation to investment, how support ecosystems can strengthen startups, and how founders can build business acumen alongside technical expertise, and how understanding the system is often more powerful than trying to disrupt it. So let's dive in. Martin, maybe we can start with you. Could you tell us a bit about your work at Health Tech Hub Copenhagen?
Sure. Yeah, it sort of comes in two different phases. When I started out almost 3 years ago, my business development role led me into having one-on-one conversations with the around 30 members we had at that time. Today we have close to 70 members, I think. Most of these are sort of fairly mature health tech companies, most based in Denmark. And I had conversation with them around 10 different dimensions, which I thought of are relevant for maturing a company. And that gave me a lot of insights into what is going on and learning from them. And of course, I hope to help them. And my main objective at any meeting really was figuring out where did they have an important fork. A fork is a decision that can be really, really relevant for the company. Because that was where I felt I could not necessarily give them an answer to whether they were going to the right or the left in this fork, but at least trying to give as much input and ask as many questions as I could so that they really have an enlightened decision in this specific case. So that was sort of the first part of my journey in the hub. And then one of the conversations that we keep coming back to was the regulatory challenges for these companies, or at least how do you bring a quality product to the market when you want to do software-based solutions for healthcare. And that conversation, we could see that that's really an area where companies struggle. So fast forward to today, during this journey, around 20 months ago, we started applying the Novo Nordisk Foundation for a grant to actually build a digital platform to help companies in this space. And that is what I've been working on the last year or so very intensely, because we actually got a huge grant from the Novo Foundation, where we now try and see if we can build digital support for companies navigating regulatory pathways. So how do you get a CE mark on your product? How do you figure that out? That is extremely complicated because companies don't know what they don't know. And then you're in a really, really bad position. And that's what we're trying to help them with in this specific space. So that is more or less at least an insight into what I do.
I see. Knowing what you don't know, what does that mean? Can you share a resource or example that captures this idea?
Yeah, I think I sort of borrowed the concept from a Danish author, Tor Nørretranders. He talked about the Danish football player Michael Laudrup and what it means to have skills on the other side of the knowing what you don't know. When you're extremely competent, you're actually so competent that you cannot express the competence because it's built into who you are. Mm-hmm. So he describes sort of a ladder where you move from not knowing what you don't know to knowing what you don't know, and being conscious, and exactly that step is so important for startups, because that's where you suddenly become competent in a way that you know, okay, I know something about this, I can fix it myself. Oh, I don't know anything about, I really need help. So you become good at asking for help, which I think is a key competence if you want to build something and you want to build it fast.
Nicola, you also work at Health Tech Hub Copenhagen with Martin, but you work on the investor side. Do you look for founders who are aware of what they don't know?
Okay, maybe I want to start somewhere else actually, because you could say when I joined Health Tech Hub Copenhagen 2 years ago and came actually out of a role as a CEO for a health tech startup. And I experienced myself how difficult the regulatory journey is to navigate. So Martin and I have had a lot of conversations about that. But in parallel, I had so many conversations with other CEO startups, and the constant theme was funding. How do you get funding? Who do you get to invest in your company? How do I secure runway for my company, etc.? And of course, I think the good thing about fundraising is there's so many investors out there, and they all have different approaches to how they invest, what they want to invest in, what type of people, etc. So you are able to find money, but of course, founders who know what they don't know are interesting to talk to because they know they have weaknesses. Whereas founders who think they know everything often turns into a red flag unless they have prior experience, because sometimes they actually may know what they need to do, but then they've done it before. If you've never done it before and still come across as somebody who knows everything, I think that's a major red flag for any investor.
I also heard that first-time founders, if they succeed first time round, they kind of get stuck into knowing everything. And then they typically don't succeed in their second ventures. Do you see this kind of tendency?
To be honest, I don't know. I think it depends on what type of venture you approach into. The closer your second venture is to your first venture, I think the higher the likelihood of success. If you've succeeded before and then you think you can succeed again in something completely different, then I think it's much more difficult.
Okay, so closeness not in time, but more in the topic, right?
Exactly.
So you get a chance first time around to properly, thoroughly understand the industry you're working in.
Just to comment on that, I think that's very crucial. I think also maybe in a smaller country like Denmark or Sweden, where we see successful entrepreneurs and they think, okay, I'm a great entrepreneur, I can jump to any domain. Let me do healthcare because now I've done banking. And I think that's impossible. That's where you risk what you're pointing at, Katalin. But I think I also spent time in Silicon Valley and met quite a few people over there. And most of the professionals, and they are good at this, is exactly, I've done this over and over again. I'm really, really skilled, but I stick to what I know. I only do SaaS solution, B2C, for instance. But suddenly you have people that have tried this 10, 20, 30 or worked in, with so many companies. So it's definitely an element of scale that we also lack in Denmark. But I think you become good at this, like with any other, aspect of life, but you really need to know what it means to be good at. What kind of game are you playing?
And lots of early stage founders come from academic or clinical environments, at least in medtech and health tech, and they often treated their company like a research project. So they definitely stick to one topic, but they also stick a little bit to the research mindset. Do you think there's a danger in that?
I think at least when you look at it from an investability point of view, there is definitely a big risk to that. I mean, we see so many, I generalize it normally, but you could say when you look at founders, and especially first-time founders in this industry, they either come through the clinical side. So as you say, the research side, they are sitting on the inside of a healthcare system. They are questioning, why do I do this work this way? I must be able to do it differently, smarter, faster, whatever it is. So they find a solution to their problem that they face on a daily basis. Alternatively, you reinvent it from the outside because you are a caregiver or a patient and you have some kind of travel through a healthcare system and you're questioning yourself, why do I need to experience a healthcare system that doesn't talk to each other or things aren't working? So, and both scenarios, you could say, create either very good clinical understanding or a very good user need understanding. So they're really good at solving these problems from those perspectives. The issue is the industry they're trying to solve it is one of the most complex systems you can find, because the decision makers are not the payers, the implementers are not the decision makers. So suddenly you may have found a great solution to the specific problem, but you have no clue how to sell it. You cannot monetize it. And if you don't get that very early and you sit and you're stuck in this research approach to it, then it's going to take you so long to find a way to monetize it.
So implementers and payers, there's a gap between who the implementer and who the payer is. And this makes it so much harder to monetize your healthcare solution. Martin, do you see in the process of taking academic innovation out to the market in this healthcare, health tech space, what major gaps do you see there?
Lots of gaps, but just, continuing what Nicolas said, there's so many dilemmas in healthcare, right? Because what Nicolas is talking about is also where innovation should come from. So it's not like we don't want the great research or we don't want the great user perspective, because it's exactly where you have the uniqueness of a product that if I were investing in somebody that did not have those, the one perspective or the other perspective inside their pitch, then I would say, well, you have no idea what you're talking about. Mm-hmm. I want this to be credible. But first thing is that, yes, one gap is that the researchers need to scale the hypothesis. Let's say this comes out of Rigshospitalet. Yeah, that's not good enough. If this problem is from Rigshospitalet, you have to show me it's also present at Karolinska or somewhere in Germany. So the researcher needs to think scale. The same goes for the user perspective. But I think when you look at this and say, yes, you're onto something, then I think it's a classic startup story. How do you build a great team fast? Because you need business people, because you can make money in healthcare, but it is extremely complicated and reimbursement models does not scale. That's one of the challenges that is systematic. You cannot change that. The way you sell to Germany is different to the way you sell to UK. It's just the way it is. But many people believe that they think they've seen so many Uber stories or Amazon stories that things scale just as long as you have something digital. And that's not the case for healthcare. So that's another gap, right? You need to educate people about how to build a business, but then also how does business work in healthcare? So, and many people mistake that, especially if you come from the outside of healthcare. But it's really, so the team is, how do you find these great business people that can help these great researchers right away? And I think that team thinking, back to Silicon Valley and back to large ecosystem, that's where you have a prevalence of people that have tried this before, and people raise their hands and says, yes, I'd like to help you. And suddenly you have these great teams. When in Denmark, nobody's saying anything and nobody's raising their hands. So it's really hard to find and do this matchmaking.
What about the TTO offices at the universities, the major universities? TTO is the Technology Transfer Office. Some of them are involved in the Open Entrepreneurship Program. I'm also part of that. It's typically designed to match founders with researchers, with business people who can help them.
Yeah, I think those initiatives are really good. The challenge with them, as I see it, is they often match with mentors and not implementers, we could call it. So you end up finding a mentor who can help you and they can have the discussion with you and they can give you some kind of guidance. But when you run a startup, of course, you also need mentors, but you need somebody who can actually operationalize it and go do it. And with a lot of these initiatives, you don't get the person who's going to be operational in your company. And I think that's the challenge.
Yep. Yeah. And another challenge is that again, and I'm not an expert in TTOs, but I've had some encounters with them. And my open question to the TTOs is, what are the TTOs' KPIs? And because I've experienced TGOs that are trying to bring revenue to a university, that they feel that that's their task here in life, protect innovation coming out of a university and maximize whatever. And that is not the same as trying to help a startup succeeding and building a business. So I think the role of the TGO, and I think there are probably many, many versions, and I think I've met them before, the open entrepreneurship and etc. Why do we have these? But at least historically, I've had some encounters where I felt, you're not helping me at all. On the contrary, you're making it hard to bring research and turn it into business. And I think if you go to the US and also listen, I mean, there are all these great stories about Stanford profiting, making so much money out of Google. But I think even in the US, it's not a revenue generating engine, the TTOs. That should be seen more from, they're helping society create businesses. And then I think maybe also back to what you're saying, Nicolas, then, okay, yes, we need to be more operational. We need to be very practical in some of the things we help people with.
But if we're being very practical, then is it a good start to start educating the researchers about how to build a business, or shall we start a step before that? Why would you want to create a business for this, for your invention? Why can't people just pick it up?
Well, I think it's very much about motives. And a researcher, many wants to get back and do more research. Now I've shown this great thing. Okay, now let me do another. Many are not researchers because, that's why they're researchers, right? They would have taken an education at CBS and become a business person instead, if that was the driving force behind them. So if that is what you're asking about, yes, so much is about incentives, but it's also about who we are as people. And that's back to my comment about teams. You need the skilled guy that wants to do research, because he's also going to help you with the clinical evidence.
So what about selling? A doctor or an academic who comes up with an invention, aren't they the most authentic salespeople? I think you told me that before.
But I think they are, you could say. But the question is whether they want to and they know how to. So and I think that's to Martin's point, you could say, what is driving them to do this? Because great innovation only turns into great companies if you have a team that can take that innovation and make it into a company. But if you're in it for the research, then maybe you need to pass it on to somebody else. If you think, okay, I made great research, I can build this into a great company, by all means, be the one that goes and do that with the team. So I think there's so much of this which goes into what is the driving force behind the founders of such a company. But I agree with you, Captain. If you're the inventor, if you're the one who have experienced the need yourself, and you're the one who is going to execute it. But then we're back to Martin's initial comment of be aware of what is it that you don't know. Because if you've never sold to the healthcare system, then you might want to read up on that because that is difficult.
Why is it so difficult to sell to the EU healthcare? This is a rhetorical question.
I think most people who listens to this podcast have a good idea of the answers to this, but it's everything from, as Martin also said earlier, what you do at Rigshospitalet may not be the same as what they do in Skyby. So even within the same country, you may not be able to scale your solution. And then you go to another country and go into another language, and the reimbursement system is different, or they may not even have reimbursement for this solution, etc. And you need to navigate and figure out your business model. Which countries does it actually work best in? Because just because it works in Denmark may not mean that it works in Sweden. It may work super well in, I don't know, Saudi Arabia or whatever. But you don't know, so you need to figure out where does it work. So that's one thing. The other thing is you have so many complexities in it because you have private hospitals, you have public hospitals, you have life science companies where your invention may be interesting. So there's so many you could sell to. So it's also a question of figuring out what business am I trying to build and to whom? And of course, the closer you get to a private setting, the easier it should be for you to make that sale because the decision process becomes shorter. Whereas as long as you are in a public setting, we just know that it drags on because, as I said in the beginning, the decision makers are not the same as the implementers are not the same as the users, etc., etc.
Yeah. So a parallel approach in attacking the market could be a good strategy.
Yes, but it depends. Because I mean, for example, we have some startups in our portfolio. Some have decided to run a direct-to-consumer model, and then in parallel, they're going for a regulatory or a medical device approval. That's two completely different business models. It's two completely different ways of driving a business. So I don't know if they go well together because, as I see it, it's two different set of competencies that you need to succeed in these two areas, even though the device may be the same. We have others, they are selling to pharma, and at the same time, they're trying to get this implemented in clinical practice. Again, two completely different types of customers, different types of networks, different type of decision-making processes. So a dual approach may be good for creating or getting to revenue faster, but it may not drive the organization in the right direction that you need if you really wanted to change clinical practice over time.
So this context dependence is really difficult to overcome then, because otherwise you would need multiple business models, multiple approaches, and multiple skill sets to succeed.
Yeah, but I think I have two views on complexity. And one is that there are just parts of the world that are very, very complex, and you cannot change that. And then at other times you create complexity which you can actually get rid of because for some reason you've made some decisions or taken things into account that say that's totally stupid that you've gone down this road. If you go down here, then your world will be much more simple. And healthcare is definitely the first part. It is extremely complex and you cannot change that. So I was just sitting, what is a good analogy? And I was thinking about Uber. And I keep coming up with Uber as that's a very simple thing to buy, book a cab and transport you from A to B. And it's a known process. It's very much the same all over the world. That was why they, in many ways, were so successful. But look at the complexity they still have. They were kicked out of Denmark because they didn't abide by the local laws. Other countries, they've had to set a minimum fare. And where do you pick people up in an airport? They were not allowed to go into normal parking spots. But they had so much money that they could sort of, let's do this crazy experiment and spend so much money initially. And then later, hopefully, recap all that. But I think it's an interesting case to see where you think, and I keep saying, booking a cab is not complex, but it actually is when you have a large fleet and you have to navigate all that. And they only manage because they've raised so much capital to do this experiment. And startups in healthcare are sort of almost playing the same game. They just have almost no money to do this. And so how the hell do you get your first cab riding the road somewhere in Denmark and then believe that ride can be done also in Stockholm, where suddenly so many things are different? That is the challenge. And as you say, Nicolas, then you have this company that's almost trying to build two different cab companies, even though they haven't taken any passenger on a ride yet. But
okay, I think I understand the key to success now in healthcare innovation. You need a really good team and shitloads of money, and then you'll succeed.
Yeah,
right?
Yeah, that's it. It's very basic.
And Nicola, from an investment or investor point of view, how does this complexity affect the willingness to invest in European health tech startups?
We recently did a research where we got 92 investors to answer a questionnaire on the investability of health tech startups. And what it showed was, one, there's plenty of capital out there. So those 92 investors, they accounted for, I think it was 14.2 billion euros. So a lot of money out there. And but what goes for all of them is the company's ability to build a scalable business and a viable business model is what is holding investors back from investing. So we're back to the point that we've just discussed, right? They great ideas, they see great research out there, but the question remains is who is going to pay for this and why are they going to pay for it? And I actually thought one of the things you said in the beginning about, you could say, disrupting the healthcare system. Well, when it comes to business models, you're not necessarily looking for disruptive business models. You would rather want something that is proven. So if you have an existing revenue stream, if you know that somebody is already paying for this service that you're providing, but now you can offer it smarter, cheaper, faster, or whatever it is, it will be much easier to tap into existing revenue streams than trying to invent and identify new budgets and create new revenue streams for your business. And I think that's crucial to also understand. So the investors are really looking at how are you going to sell this? Who is paying for it? And if you don't have a very clear answer to that, then you're not investable.
Mm-hmm. And do you think, Martin, that founders understand this?
Yes and no. I mean, the ones that don't know what they don't know, they don't. So I think that there's definitely a challenge there. But I think in many ways that when we talk about startups, we also see a maturity. And I think we at the hub, we're part of this conversation where there's some basic knowledge that is spreading. And I mean, as people start being more skilled in entrepreneurship, et cetera, and it is a thing that is out there in much wider degree, we have a higher maturity. But I still think it is a challenge.
Mm-hmm. Founders who come from a non-commercial background typically have no clue about business models. I mean, I've met researchers who, and myself included, who approached finances and business model. You know, when you try to calculate how much is going to be your income from selling this product, and then with the research mindset, you approach it like, where's the statistical evidence for this? I need to look into the data and figure it out. But then really when you're developing a business model and trying to figure out how your sales are going to pan out, then you just make up the numbers based on what you know is out there approximately, and it's more like setting targets for yourself.
Yeah, and that's actually one of the places where I think you bring complexity into something that shouldn't be as complex.
Yes,
especially if you're a researcher or you, let's say you're a doctor at least the ones that come from inside. Back to what Nicolas talked about. I mean, even though value-based healthcare, another term, is not taking over the world, it's still just a great way of thinking, because you have to be able to formulate what is the value I create, convert it eventually into monetary terms. But it starts by talking about, well, will this make the life easier for the doctor or for the nurse or for somebody transporting the patient to the hospital? So looking at value and impact, what is the change that your solution is actually facilitating? And try and describe that by words. And that can a researcher do. That's not asking you to put a price on your product. Mm-hmm. But all that information is actually what eventually should decide the price, at least from the inside out. Okay, this is, if we are actually saving somebody 10,000 krona every time they have to do knee surgery, then that's a great thing. And can you save those 10,000 krona? Well, in Stockholm, they might do knee surgery differently. So it's only 5,000 or whatever. So you can travel with this value story. And that, I think, is one way of bridging also competencies from the researcher into the business. Because then eventually, okay, if that's the value, then people are skilled. That's a more mature. That's what Novo, that's what Ambu, all the pharmaceutical companies play this game. They're just very skilled at it. And also sometimes maybe overdoing the value you create from a given drug that is in version 12 or whatever. But that, I think that is one thing that you really could use to bridge from the outside in. When a patient experience, I want to optimize my journey. Sometimes they miss out on what is happening behind the scenes. And maybe what a patient thinks could be improving my journey might actually complicate what happens on the inside. And that's why you could have the opposite drive, that yes, you're creating this value, but that's not really nobody going to pay for this because you're making it a bigger burden for the hospitals to serve you.
Coming from a non-commercial background it can be really difficult to wrap your head around all these business models and how procurement procedures work and how you can create revenue for your product. How do investors view founders who come from non-commercial backgrounds?
As we said earlier, that in itself is not an issue, because normally they understand the clinical need or the user need really well. So it makes sense that they come from that side often.
Mm-hmm.
I think the question is, how much have they done to navigate the commercial part? And if they're not the ones who has to navigate it because they don't get it, then we're back to the team. As an investor, you rarely invest in a one-man band because the risk is so high. If something happens to that person, you're out, right? So if you have the clinician, but that clinician has found a person who has a very solid commercial profile, I mean, you're good.
Yeah, but you need to pay them unless you're co-founders, right?
Yes, and that's of course always, and I think that's one of the reasons why a lot of, especially startups in our sector, they're running behind on the commercial side because they're so focused on fixing the problem, and they don't need a commercial person to fix the problem because they have a very good understanding of the problem in the first place. So the issue is they don't have necessarily the money because they haven't raised the investment yet, or they don't want to spend the money on the commercial aspect early on because they still think that they need to build the perfect products. And what it ends up with is, once they build what they think is the perfect product, they get the commercial person who then starts to go out and talk to clients that are outside the network of the founders. And suddenly they find out that actually there are things that they should have considered earlier in the product development. So you're extending the runway that you need for the company because you are taking the commercial considerations in too late in your company. And that's super difficult to navigate because either you find the co-founder who is willing to invest some time, maybe not all the time in the beginning, because maybe there isn't enough money or enough job to be done very early, but they're still willing to allocate time to help. Or alternatively, you find the investors who have that understanding and saying, I know that you are not generating revenue for the next year or next 2 years, but I still want you to find that commercial person already now because that allows you to create revenue in 2 years instead of you hiring the person 6 months before, and then you're going to spend another year and a half. So it's 3 years instead of 2.
Mm-hmm.
You could say what's really needed here is that you bring in that co-founder very early, and you actually have to give part of your company, part of your idea to this person. That can, of course, that doesn't feel right because all the innovation, I did all the innovation. Why should I give something to you? And yeah, that's because this guy knows a lot about the things that you don't know anything about. But it's a mental thing that I think is difficult. And again, we don't have a culture, and many doctors or wherever will say innovation like this comes from them. Then it is the first they've ever done. I mean, we know here in life things that we only do once, we're not very good at.
Mm-hmm. There are all these founders standing at the edge of the valley of death. What is one piece of advice that you would give them?
I'll just probably repeat what I've said many times already now, that you should really avoid being in situations where you don't know what you don't know.
Nicolas?
Find out who's willing to pay for your solution.
Thank you so much for your time.
Thank you, Kathleen.
Thank you.
That's it for today's Walk the Valley. This episode is a great reminder that saving money long term often means investing a bit more earlier. Waiting to think about the business development until the product is finished can backfire. Building product and market in parallel saves both time and resources. We also talked about what builds investor credibility. Products that fit into existing budget streams are far easier to back than those that rely on entirely new ones. And just as important, knowing what you don't know. That awareness is what helps founders ask better questions and keep moving forward. If you enjoyed this episode, don't forget to subscribe and leave a review. It helps us share more unfiltered insights from innovators shaping the future of healthcare. You can find Walk the Valley on YouTube, Apple Podcasts, and Spotify. Thanks for listening, and until next time, keep walking the valley.